Welcome to Rumor versus Truth, your trusted source for facts, where we dissect the evidence behind risky rumors and reveal clinical truths. Today, we'll stir the pot with natural remedies for cold and flu symptoms.
Hey, Steve, how you doing?
Doing all right, Don. How about you?
Not too bad. Hey, I have to ask you, what is your go-to remedy when you have a cold or flu?
Oh, well, usually it's probably a lot of chicken soup and a healthy dose of denial because I do not like being sick. What about you?
Same thing. Chicken, some kind of clear soda, and a full day of Price is Right playing.
Oh,
So,
yeah. That clears all ills. Yeah.
yeah.
And I'm Steve, the pharmacist.
And I'm Don, the pharmacist. And in this episode, we're going to brew up some clarity on natural medicines used for cold and flu symptoms. Was Grandma right about some of those old remedies?
We're going to find out if she was. And great news, this podcast now offers continuing education credit for
Mhm.
pharmacists, pharmacy technicians, nurses, and physicians subscribed at our platinum level or higher.
Yep, just log into your pharmacist letter, pharmacy technician's letter, or prescriber insights account and look for the title of this podcast and the list of available CE courses. So, for purposes of disclosure, none of our speakers have anything to disclose.
Right. And now don't worry, folks, even though we're adding CE here, we're still going to have all the puns that you know and love from us.
We are naturals at it after all.
Oh, good one, Don. So, first, let's dig into some roots of natural medicines first, especially the stats behind it. Did you know, Don, that over 30% of people in the US, and we're talking 80% of people in the world, use natural medicines and home remedies to treat cold and flu symptoms, things like sore throat and cough?
You know, I had to hide my shock face, but I believe it. I've seen the cold and flu section at my pharmacy, at other pharmacies, and it's just packed full of all these vitamins and supplements for preventing and treating cold and flu symptoms.
Oh, for sure. And so while we squeeze out the truth on these claims, stick around. We're also going to answer a listener's question about dental health from our last episode.
Yep. And all right, Steve, before we leaf through that first claim, we got another blossoming moment for the show.
Yeah, we're thrilled to welcome a special guest to Rumor versus Truth, someone who's not only a fellow editor here at TRC Healthcare, but also brings deep expertise with natural medicines.
That's right. So please welcome Jeff Langford, PharmD, BCPS, BCCP. He's a managing clinical editor with TRC NatMed Products, and he wanted to plant himself right here in Rumor versus Truth. We were tackling myths about natural medicine products for cold and flu.
Well, thanks, Steve and Don. I'm excited to dig in here with you guys today. Natural medicines are certainly always alive. It's an area that's packed with misconceptions and sometimes misinformation. And I'm looking forward to offering some sage advice on this and help clear things up for you all and for our listeners.
Jeff, you're going to fit right in with those puns. I
That's
guarantee
for
it.
sure.
So with that, let's peel away the layers of this first claim. And it is vitamin C and zinc can shorten cold symptoms. And Jeff, I said earlier about pharmacy stocking just a ton of these products, right? And looking at the labels, you see a lot of them contain things like vitamin C and zinc. That's kind of seems the common thread with these particular products. So, and I say a ton, I don't think I'm exaggerating a whole lot. So what's the deal? And why do so many of these natural cold and flu meds and supplements have vitamin C and zinc in them?
Yeah, great question. And absolutely concur with what you're saying there, Don. We
Mm.
see these things stacking up on pharmacy shelves and on social media claims about their benefit. And it's partly for good reason. We'll discuss that, but we'll start with vitamin C. It's been theorized to be helpful for colds for over 70 years. And some data show that oral vitamin C in high doses, a gram or more per day, might decrease the duration of cold symptoms. It's not by very much, about a day to a day and a half, shorter duration of cold symptoms. Now, Don, I expect that you're going to get kind of juiced about this. Before you do, let's think about some of the caveats. These studies in general looked at taking vitamin C regularly, not just when the cold symptoms started. So, to get a benefit, people were taking it all the time. If they were already taking it before they got a cold, it might be a day or a day and a half less with symptoms than people that weren't taking vitamin C at all. On top of that, the doses were high, generally a gram or more, as I said, but sometimes they went up to 4 grams per day. Um, that's a lot of vitamin C because our supplement doses usually are going to be in the 500 to 1,000 milligram per tablet or capsule range.
Yeah, that's quite the pill burden. And for folks who are really into juice, the juicers out there, I found that there's about 40 milligrams of vitamin C in an average orange and about 125 milligrams of vitamin C in a typical serving or 1 cup of orange juice. So there'd be quite a juice burden here for those folks as well if they went that route. It could be up to 32 glasses of juice, right? That's
Mhm.
pretty astounding. But with that, let's jump to zinc. I often see this paired with vitamin C, Jeff.
Yeah, absolutely, Steve. That's kind of the second half of this question. And when we look at zinc, a little bit different nuance here. Majority of clinical trials do show that we get a decrease in the duration of common cold symptoms. So again, nasal symptoms that go along with colds when adults are using zinc lozenges. And that's usually like the zinc acetate or a zinc gluconate lozenge. Strengths are typically like 9 to 24 milligrams of zinc in those. And we saw a little bit bigger benefit here. Our average duration of cold symptoms was shortened by about 3 days with zinc. Think back to that vitamin C, we were saying about a day to a day and a half. So, slightly larger potential benefit with zinc in this case.
So, yeah, looking at this data, Jeff, wasn't the frequency of intake of zinc a little surprising?
It's pretty intense, Don. Yeah. So, these studies typically looked at using those zinc lozenges every 2 hours while awake. So, that's up to 8 lozenges potentially a day for many people. And you had to start it within 48 hours of cold symptom onset. That typically stacked up over the course of that day to a dose of zinc of around 75 milligrams. Note the difference here is we're talking about starting zinc when cold symptoms start. With vitamin C, we're saying use it all the time, in either case to shorten duration of cold symptoms.
Yeah, it's good to point out that difference and good to know about the actual evidence that vitamin C and zinc can reduce the days of cold symptoms, but vitamin C needs to be taken regularly prior to the cold. But that is really frequent dosing for zinc lozenges. I can barely remember to take a daily multivitamin, so I could see some people really not being able to keep up with that if they're feeling crummy, doing that every 2 hours. And plus, we know if something's natural, doesn't necessarily mean that it's free of side effects or other issues, right?
Yeah, absolutely, Steve. That's kind of our take home point when we talk about natural medicines. And we really have to keep that perception top of mind or that information top of mind to help kind of reset perceptions for patients. But when we think about vitamin C, for example, we consider the tolerable upper intake level for that to be about 2,000 milligrams a day. More than that can lead to GI side effects like diarrhea, stomach cramps. And high doses, even 1,000 milligrams or more per day, has been linked to an increased risk of kidney stones, particularly in patients that are prone to them. And that might be patients with a previous kidney stone. Um, we generally think that if you've had a history of a stone, that increase puts you about a 30 to 50% higher chance of having another one. So if you throw some vitamin C in the mix, risk could go up from there. So those are kinds of things that we need to talk to patients about when we're talking about natural medicines or any medicines.
Mm.
Um, and on the zinc half of it, zinc, of course, has an unpleasant taste. So you mentioned taking those lozenges 8 times a day, not only remembering it, but if it doesn't taste good, that's not going to help things out there either. And lots of considerations with zinc in terms of drug interactions. We know as pharmacists, we're very commonly counseling about things that can bind with certain antibiotics or HIV meds and reduce absorption. Zinc would go in that category of things that can do that as well.
All right. Thank you, Jeff. Yeah, thanks for doing interaction stuff in there as well. Uh, so patients actually might be treating their cold symptoms for gastrointestinal symptoms
Mhm.
and the metallic taste in the mouth. So good for everybody to know that one. And actually reminds me of, this might be before your time, Steve, but actually reminds me of that intranasal zinc that they pulled from shelves, geez, probably over a decade by now, for people losing their sense of smell with it, in some cases actually permanently. So if your patients are asking for nasal products for cold remedies now, they are zinc free and usually homeopathic in those
Yeah.
cases.
Good point, Don. I'm glad we sniffed out the truth on that one.
Okay. All right. Let's go back to that claim. So the claim is vitamin C and zinc can shorten cold symptoms, and the verdict is true with conditions. Vitamin C and zinc can shorten the number of days with cold symptoms, but be ready for those caveats like Jeff mentioned with that to be taken regularly for vitamin C, and also the side effects with zinc come into play.
Yeah, good point. And circling back, does vitamin C and zinc work in preventing colds? Because so far we talked about treatment. I see people popping everything they can before flight so they don't get sick. What do you think, Jeff?
Yeah, great follow-up question there, Steve. No clear benefit for prevention in either case. Overall, when vitamin C has been studied for prevention, it doesn't seem to affect the risk of getting a cold from most patients. And with zinc, data are mixed, but they're too mixed to be reliable to consider it really effective or something to recommend to our patients. So we really want to kind of hang our hat and continue to emphasize good prevention strategies instead of vitamin C or zinc. And that would be things like avoiding touching your face and eyes, appropriate hand washing, disinfecting surfaces, and all of those good proven strategies.
Yeah,
As
thanks,
I
Jeff.
touch my face and eyes during this entire pod. But thank you, though. Thanks for reminding. Thanks. That's a good reminder.
And
Always
maybe
there
to
for you,
help
Dom.
out, maybe to
Yeah.
help out Don with this, it's a good time to remind
Please,
everyone.
please.
We
Yeah.
have a great online resource, Managing Cough and Cold Symptoms, where you can review all of these considerations. Check it out, especially you, Don.
And we're talking about vitamin C and juice actually takes me back to our very first episode, Juicy Interactions. And if you want to know more about how fruit juice like orange and grapefruit juice can mess with certain meds, that's a great one to check out in our back catalog.
Yeah, those were the days, Don. A very good throwback. Definitely a good episode, and you could say it's our pre-CE era.
Yeah, good call out.
And let's tackle our sweet next claim that always gets a lot of buzz, you could say, and it's that honey is effective for cough. And this kind of makes me think back to like Mary Poppins and her whole spoonful of sugar makes the medicine go down shtick, right? Except that the actual medicine is sugar itself, essentially. So, Jeff, what does the data say about the use of honey for cough?
I like this one, Steve, because I think it's an area that is promising for people and it's also pretty simple. And the answer is that most studies show that oral honey reduces cough in kids. Studies have looked at doses around 2.5 to 10 mLs. It seems to reduce the severity of nighttime cough. As well as the frequency of nighttime cough. All of that leads to kids sleeping better and probably in turn parents sleeping better. That piece wasn't in the study, but just kind of throwing that consideration in there. The data is mostly in kids 2 and older when they have some kind of upper respiratory tract infection. And honey has also been compared. So those studies were looking at it versus a placebo, but it's also been compared to other active treatments. They looked at it versus, say, dextromethorphan, for example, and honey seems to be at least as effective as dextromethorphan for suppressing cough in kids.
So good news for those who wish to avoid the side effect dextromethorphan, right? Some people tend to feel a little loopy on it, and those effects can be compounded in children. You did kind of emphasize children earlier, Jeff. And so naturally the question comes to, what about adults? What about me? What if I want to do that spoons full of sugar for that cough? What's the advice there?
Yeah, the data in adults are unclear. So there is a meta-analysis of research that looked at honey in adults and suggests that it doesn't improve cough when compared to usual care. But statistics come in here and there's just a very limited pool of data, so small number of studies to start with, and that analysis may have been underpowered to detect a benefit, particularly if that benefit was kind of small.
Yeah, I like that you bring up the statistical piece there. And for those who may not be familiar with what power is, if something's inadequately powered in terms of a study, that means that it's lacking something. Usually, it's lacking enough participants, especially if maybe the effect we're looking for is really rare or low. So, if you don't have enough patients or subjects in that study, you may not find a change, even if it is true. So, that might be what we're seeing with honey.
Yeah, powerful thought there, Steve. I like that. Some research in adults has looked at combinations, however. And so, for example, honey has been combined with other things, like mixed with coffee into a paste. And in that case, it did suggest some benefit. So there are some other pieces of data out there looking at different things.
Yeah, paste does not sound appetizing.
Not particularly.
I think I'd rather have a cough. Yeah,
Right,
maybe.
But is it okay if adults want to try honey at least?
Yeah, I think what we want to ensure in that conversation is just that we give a balanced perspective. We want to let people know that the data doesn't necessarily support a benefit, but there's probably very little risk in this case. We'd want to consider any possible downside. So, for example, if a patient has particularly uncontrolled blood glucose, giving taking extra honey with glucose in it may lead to higher levels in that scenario theoretically, but for many people, it'd be absolutely fine to give it a try.
Nice.
All right. And one thing I kind of noticed when I was looking at the honey products is they're all created the same. So there's actually one called rhododendron honey that contains something called a granotoxin, and that actually can lead to cardiovascular side effects. I saw some like hypertension, low blood pressure, arrhythmias, and chest pain. And it's actually called mad honey, which is a fun kind of term to kind of let patients know when they're choosing products to be careful when they're kind of purchasing those different honey
Good point, Don.
products that are out there. Yeah.
And with that, let's go back to our claim that honey is effective for cough, and the verdict is true with conditions. It's shown to be effective in kids, but not necessarily adults. And adults are free to try it since risks are low. Plus, we all know it's tasty. And this also had me thinking, folks, that I'm a pediatric pharmacist and we avoid honey in kids under 1 since their stomachs can't effectively destroy botulism spores that could be found in some honey. So, botulism can be deadly. Think about that.
Yeah. Good call out, Steve. And then I'm thinking about honey again because it just came out of my mind. Uh, on my way home driving on the side of the road, I do see like these stands for locally sourced honey. And looking up, there's actually quite a big market for locally sourced honey. Jeff, does that help out at all?
Yeah, so people tend to reach for locally sourced products, honey, for allergy prevention. So lots of interest in it in that space, but no good proof that locally sourced honey or even honey in general is good for allergy prevention or treatment.
Okay, that's good to know. So it is okay to go to big honey when it comes to this. So thanks, Jeff, for that. And what you can also let audience know is to check out our managing seasonal allergies. We have a great chart online with this topic for more improving
Mm,
treatments.
yeah. Beautiful, Steve. I remind folks in the audience to take a look at the show notes for this episode. We link directly to the chart in Pharmacist Letter, Pharmacy Technician's Letter, and Prescriber Insights, and a few other related to this episode for easy access.
Yeah, and if you aren't already a subscriber, don't miss out on these resources. Sign up today to stay ahead with trusted insights and tools.
Yeah, and don't forget, our subscribers can claim CE credit for listening to this episode. There's a handy link in the show notes that take you right to the CE course once you finish listening. And let's go ahead and not beat around the bush with this next claim. And it is elderberry can treat the flu. So I've seen elderberry. There's a lot of different products out there. It's in elixirs, capsules, teas, and other drinks with claims of improving flu symptoms. So it's pretty popular. Jeff, we're all very curious. Is there truth to this claim?
Yeah, good one. Elderberry is possibly effective for reducing the severity of flu symptoms, so the achiness, coughs, based on small studies, and those are in generally healthy adults with the flu. Some things to know about those studies as we kind of turn that over a little bit is that the doses varied. So some of them used elderberry extract lozenges, like 175 milligram doses, or an elderberry extract syrup, typically 15 mLs, and those were dosed 4 times a day over a course of 2 to 5 days. Again, people needed to start fairly early after symptoms began, so within a day or two. And in those cases, what they found in those groups of patients is that flu symptoms improved about 4 days earlier than the control group. Symptoms didn't necessarily go away, but they improved. And it did reduce the use of what we think of as rescue medications, so analgesics, traditional conventional cough and cold medications. But, and there is a big but here, not all data are positive. It's not been shown to reduce the overall duration of flu symptoms. And there also isn't any good evidence for elderberry extract in kids, even though if you look on pharmacy shelves and in supplement sections, you're probably going to see some things that are labeled or kind of targeted toward use in kids.
Yeah, really good distinctions to sort through those claims, Jeff. And elderberry can reduce severity, but not duration of flu symptoms. What about the safety behind elderberry here?
Okay, and that's an important distinction, Steve. What we want to think about is that these extracts, so the oral elderberry extracts that were studied for flu, do seem to be well tolerated in short-term data, but There are some caveats, and that's that elderberry itself, especially raw or unripe berries or other pieces of the plant, can be toxic. They have a cyanide producing chemical that can cause some serious toxicity if patients eat, again, the raw or unripe berries or other plant parts that aren't cooked. So we definitely want to kind of draw out that distinction between the extract syrups and lozenges and elderberry in other forms. And probably another important consideration in this space is that there's not good data for patients who are pregnant or lactating. So we want to discourage use in those patients just based on a lack of evidence.
Yeah, good call out, especially since pregnant and breastfeeding patients may be more interested in using natural medicines to avoid harm to their
Mm,
baby with maybe more like OTC medicines.
for sure.
Absolutely.
Yeah.
Yeah.
And also, I think elderberry, like, when I was reading on it, it does stimulate the immune system. So there are theoretical interactions with autoimmune diseases like rheumatoid arthritis, with actually immunosuppressant medications like cyclosporins, something to keep a lookout for. Add to patient profiles so everyone getting on the same page and try to spot those interactions. So let's go ahead and go back to that claim, and it is elderberry can treat the flu. And the verdict is true with conditions. Elderberry can reduce severity, but not duration of flu symptoms. And there are some safety considerations to consider before patients try it.
Yeah, and this is making me think. I actually am seeing tons of recipes online from people swearing by elderberry tonics that they're making at home, and I'd wonder how effective that really is for flu symptoms like sore throat. What are your thoughts on this, Jeff? Is it just a good mixer? Does it actually have evidence? Like, what are we talking about?
Well, I think it's a spirited idea, Steve. Alcohol has not been actually shown to relieve flu symptoms like sore throat, but anecdotally, we've heard about it for years, and it's possible that these kind of hot toddies might make people feel a little better just because of the warm liquid or the
Sure.
lemon or the honey that are included in them. So that may be some thoughts behind it, but bottom line is anecdotal only.
Yeah, not strong evidence, but sounds like it could be fun to try.
Yeah. Just don't drive any podcast that day, Steve.
I promise. Yeah.
Yeah. So before we get into our next claim, a quick reminder, if you're enjoying this episode and want access to even more clinical insights, check out Pharmacist Letter, Pharmacy Technician Letter, or Pharm Prescriber Insights. As a listener, you can get 10% off a new or upgraded subscription with the code RVT1025 at checkout.
Great. And let's recap here before we go into our next claim. We started with vitamin C and zinc, added a spoonful of honey, and took a very careful look at elderberry. Now let's see if our last claim is also something sweet or frankly just too good to be true. And is that homeopathic products such as oscillococcinum can prevent or treat the flu?
And before we let Jeff loose on this one, just to define that homeopathic product is a remedy made from plants, minerals, and animals that is prepared through a process of extreme dilution and shaking.
Right. It's based on the principle that like cures like, meaning a substance that causes symptoms in a healthy person can be used in maybe a highly diluted form to treat similar symptoms in a sick person.
All right, so a good sum up, and I pronounce it as oscillococcinum, but uh, as one of the popular ones. But Steve, since you're highlighted on that one, I want you to spell that one for us. There
Especially
you
since I screwed that up.
go. Yeah,
Let's see.
it's okay.
Oxalococcinum. Oscillococcinum. Oscillococcinum.
Let's say that's right. Good job.
Good, I passed the spelling bee.
Yeah.
Well, Jeff, can you give us the lowdown on this particular homeopathic product? I don't want to say it again.
Yeah, and I think I'm going to try to steer clear of the pronunciation there as well, Steve, just to give that a wide berth based on the history so far. But I will tell you a fun fact about it. That particular product, the oscillococcinum, does come from the heart and liver of wild duck. So kind of very interesting sourcing to have in the background as we think about the claim. And there are some data to suggest that homeopathic remedies based on that product may reduce the symptoms and need for those rescue meds and flu, pain, and fever medications. But I think we have to put a big caveat on this one that the research is potentially biased based on industry funding and poor methodology in the study design. And on top of that, the benefit that they detected honestly might just be too small to even make a difference to patients. So we'd chalk this one up as insufficient evidence so far.
Right. So this might be quackery in the end, you say?
Perhaps, Don. So when it comes to this claim that homeopathic products such as oscillococcinum can prevent or treat the flu, the verdict is rumor. And I think probably our next Rumor versus Truth episode should be how to pronounce some of these names. So, in general, we should lean away from these as cold and flu remedies since typically homeopathic products don't have strong evidence.
Right. So if there was only a homeopathic remedy for our bad puns.
Only time will tell, Don.
Yeah.
So, Jeff, what's the bottom line truth we should share with our listeners today?
Yeah, I think we can take away that some natural medicines can be used for cold and flu treatment. So we talked about zinc, for example, to shorten cold duration, honey being helpful for cough in kids, potentially elderberry in the flu. But it's always important for us to help people sort out the claims, keep the actual size of the benefit in perspective, and don't forget about the downsides that can go with any therapy that we add. Of course, the things we talked about today really are just the tip of the iceberg with natural medicines for cold and flu. So people are going to get questions about other things like N-acetylcysteine, Panax ginseng, and lots of other things. So I want to point folks back to our NatMed Pro product. It's a great resource. You can look up all the things we talked about today and all of the other things that patients may ask you about to really drill down the solid evidence-based advice that you can share with patients and with other healthcare providers as well.
Excellent points, Jeff. And thank you for joining us today and sharing your NatMed expertise.
Yes, Jeff. Thank you for lending us your brain today. Is there any parting news?
Yes. First of all, thanks for having me. It was really fun to have this conversation with you and find some other people that like puns as much as I do. But anyway, thanks for the opportunity. And the news I do want to talk about, Don, is that today's discussion is exactly the kind of thing we're going to cover on a new show that I'm hosting, Natural Medicines, Evidence and Practice. The idea there is simple. We're going to take the latest supplements and integrative therapies, translate it into practical point of care guidance. We're soft launching now. In your interest, guys, what we're going to build. First, join the notification list via the link in the show notes so you don't miss episode 1. Then, if you're already in your podcast app, tap below to listen to the trailer and follow on Apple, Spotify, or whatever platform you prefer to use.
Love that. Evidence, not hype. Just like what we do here. And I'm excited for what you guys come up with. So join the list and follow the feed now so you're set for launch.
Yep.
All right. So while Jeff's heading out, but Don and I will stick around to answer a listener question from our last episode.
Yes. So one of you emailed us at our rumor versus truth at trchealthcare.com email address. And they asked us, can ADHD stimulants like Adderall and Vyvanse cause tooth decay?
Yeah, interesting question there. And well, when I think of ADHD medications, particularly stimulant types like dextroamphetamine, methylphenidate, things like that, those can contribute to tooth decay and other oral health issues, mainly due to their side effects.
So which one of the side effects are particularly concerning for dental issues?
Yeah, it really boils down to the fact that stimulants can cause dry mouth. Saliva is important because it helps wash away food particles on the teeth and also contains buffering agents that help us neutralize acids in the mouth. And higher acidity, as we know, can cause enamel erosion, which can then increase the risk of cavities. Also, you can see bruxism with stimulants, and that's where you clench or grind your teeth, especially at night. And as you can guess, this is going to lead to more enamel erosion and also tooth sensitivity along with that.
Right. So the listeners are probably parched for recommendations here. So what do you have for us for treating dry mouth?
Yeah, really, it's ensuring patients stay hydrated to combat dry mouth. They can use a sugar-free gum or lozenges to really stimulate that saliva production, or even more importantly, is maintaining regular dental checkups and cleanings. We should all be doing that. And they can consider night guard if they're having this bruxism or teeth grinding problem too.
Perfect. Yep. I'm sure Dr. Chalmers, the dentist from our Rumor versus Truth episode, would agree. So thank you, Steve. If you have any natural medicine claim that you want us to dig up, send it in. Maybe we'll shake something loose in a future episode. Email us at rumorversustruth at trchealthcare.com or send us a text right from the podcast show notes.
Yeah, we know you got some great ideas for us to demystify. And in this episode, planted a seed of knowledge. Be sure to follow, rate, and review Rumor versus Truth wherever you get your podcasts. And of course, check us out at trchealthcare.com.
You can also help grow our show by telling a friend about the awesome things you've learned about and where you found us. And a quick reminder for our special 10% discount we mentioned earlier, just use the code RVT1025 when you check out.
Yeah, and if you're a student, even better, students can access a free version of Pharmacist Letter. We've got links in the show notes that take you directly to the right places to take advantage of these awesome deals, so go check them out.
And also, don't forget, you can also get C credit for listening to Rumor versus Truth. Click the claim credit link in the show notes and search for it in your CE organizer. And join us next time where we'll digest claims about side effects with GLP-1s for weight loss.
Yeah, thanks for joining us on Rumor versus Truth, your trusted source for facts, where we dissect the evidence behind risky rumors and reveal clinical truths. See you next time.